Right, we have people coming into the room. Hello, everyone. It's really nice to have you here again tonight. It's really great to be among other restaurateurs. We've been handling a lot of press calls and a lot of calls with politicians today. So it's really nice to be with our own people and know that we can kind of let our hair down and breathe a little bit as we go into something very, very serious. I see a lot more of you are joining us, so I'll give it a couple more seconds. But in the meantime, we'll go ahead and do introductions. My name is Anna Tausen. I'm the Chief Revenue and Innovation Officer for the Texas Restaurant Association, and I've been handling all the media and comms since the pandemic started. Joe?
Good evening, everyone. Thanks for joining tonight. My name is Joe Monastero. I am the Chief Strategist and Operations Officer for the Texas Restaurant Association. Also, responsible for the activities of the foundation, which includes our Texas Restaurant Relief Fund, which has obviously been very, very busy of late. So thank you all for joining us for tonight, and we'll hopefully have some fun. Kelsey?
Kelsey Erickson-Stroifert. I am the Vice President of Government Relations and Advocacy as of about 14 days ago with the Texas Restaurant Association.
Great, and Emily Williams-Knight, President and CEO of the Texas Restaurant Association.
Great. Thank you, Emily. So I think let's just start a little bit, Emily, with what are we doing here tonight? Why are we having this conversation? What happened today that makes everyone join us tonight?
Yeah, absolutely. So I think we were kind of waiting for today. It feels a little bit like we were waiting for quite a while for today to get here. And most importantly, at 2:30 today, Governor Abbott walked through a number of, I guess, opportunities for us to reopen, different sectors to reopen. And I think what he laid out for us was a really good plan that was based in science and obviously in the economy, and trying to do this safely and thoughtfully. There were a number of things that we really like about what he went through today. First and foremost, we see lots of examples of the Texas Restaurant Promise throughout the guidelines. We saw a very important, I think, and appropriate nod between customers and our restaurants. So we can make sure that we're in this together. We've been saying this all along, that if we just simply open our doors and we don't have a partnership with our customers, it's going to be really hard for us to move forward. Most importantly, too, there's a 25% guideline on capacity to start. And I think, you can look at that two ways. We've had lots of people ask us, is that too fast? And others that say it's not fast enough. I think one of the things that Governor Abbott has been consistent about is looking at data and really making thoughtful decisions with his health advisors and his team of medical experts, which are some of the top in the nation. And so based on that, we feel like this is a moment in time. It gives our restaurants a chance to get their feet under them. We've got to get the supply chain moving. We've got to get employees. There's lots of things to now think about. And so from our standpoint, I think what's really important is that we kind of know where we're headed. Our next milestone is the 18th of May, if not sooner, that we follow the guidelines that were laid out. He did a number of things to help us, quite frankly. One of the things we pushed very hard for was consistency across the state. And so his really mandation that this order will supersede any activity locally will ensure that our operators at cross counties and cities will actually have an opportunity to have consistency. And as Kelsey likes to say, that our customers also will experience consistency no matter where they dine. And so we feel like it was a good outcome. It's going to get employees back to work. We know that running at 25 or even 50% capacity is not a business model that's going to work. We accept that. But again, this is a moment in time. This is not forever. And what we don't want to do is we've watched very closely other states that have been really erratic in how they've opened, not communicating with the governor's office, very inconsistent. Some of my colleagues in other states frustrated because they can't get the right answers. I think this has been really well laid out. And I feel like it is on a path that's going to allow us to stay open and not in September go back to closing everything down again, which is what we don't want, or any flare up. So lots of reasons to be here, excited to be here, and almost feel relieved that we actually have an answer on what's next that we've been waiting on for many weeks now.
That's great, Emily. Kelsey, did you want to add anything before we jump into questions around what happened today with the governor's executive order?
Emily hit on the high points. What's great, like she said, is that we have a roadmap for our path forward, and we can start to build on that. And to be able to say we now have this roadmap from the governor, who's consulted with true medical experts, I think is a relief, and it adds legitimacy to this process, and it helps us assure our customers that we do stand ready to welcome them back into our dining spaces in a thoughtful, safe way.
Perfect, perfect. Emily, can you talk a little bit about the Texas Restaurant Promise and how that material and your work with various task forces around the state helped shape what the governor came out with today?
Yeah, so we, about 10 days ago now, I guess just under 2 weeks ago, we knew that this was becoming and we wanted to be prepared. So we actually assembled a group of thought leaders from our biggest chain restaurants in Texas, Darden, Brinker, Pappas, others, as well as independent restaurants. And it was a great group of leaders that came together to talk through what does it look like to open a restaurant. Our chains and independents, while serving a customer, may have different accesses to resources or supply chains or lots of things in the back office. So we wanted to have both voices at the table. And what came out of that was what I call kind of an operations document. And that operations document was best practice for how to reopen. Everyone has to remember we're experts in food safety and sanitation. This is what we do. I like to say we're not like asking zookeepers to all of a sudden start serving people, right? We're really good at this. And so we wanted to make sure we had guidelines that were easy to implement. But then we went to the National Restaurant Association, and they actually had a team of experts, including the FDA, different state health authorities, and we merged those two plans together. So we feel like we have the science and the health along with the operations that are going to work. We put it into one restaurant promise that really is a commitment between customers and guests. We first sent a complete package to the Lieutenant Governor's task force and worked closely with them. We then went to the strike force and the 3 members of the strike force and made sure they had all the materials, so that was really our voice at the table and the collective voice of restaurants of Texas saying, this is how we would like to reopen. And so we were very, very pleased today, earlier in the day, when we saw evidence of the work and number of the mandates that could have been a bit crushing actually to restaurants' ability to operate that were not in this document. So we feel really good about where it landed.
Yeah, I think it's pretty succinct. One of the questions we got earlier from the press was around how diners, obviously, when they go into restaurants, they may not be wearing face coverings. So how whenever we open dining rooms, are we going to be able to keep employees safe, even though the diners are not going to be wearing face coverings?
Yeah, Kelsey, you want to take that, or I can take it?
Yeah, I'm happy to jump in. You know, I think we keep going back to CDC guidelines, right? Because the CDC is the expert in public health and communicable diseases. And I think what they emphasize again and again is that social distancing is key. Hand washing regularly, you know, for the 20 seconds, 30 seconds, hand sanitizer, right? Those are kind of the fundamentals of preventing the spread of COVID-19. And so we've got to make sure that we are consistent and really strict about following those procedures. And then there's other pieces to this too that again come really directly from the Texas Restaurant Promise. You know, employees to make sure they're healthy before they start a shift. Making sure that customers are aware before they even come in that if they're sick or exhibiting symptoms or have been in contact with someone with COVID-19 recently, that they don't come in. So it's really a whole continuum of things that together are going to help keep employees and customers safe.
Perfect. We've got a question in the chat already, and I kind of want to bring this up because I know it's been brought up a couple times around different entertainment that often goes along with restaurants that are out there right now, including playgrounds. But Jennifer's asking specifically about bowling, arcade, escape rooms, all that stuff you sort of see as entertainment out in the industry. How is that going to be handled? Should people engage in some of those things at 25% capacity, or are they closed?
Yeah, our understanding is this applies to restaurants, and those are restaurants because they have a dining area inside. And so I think at this point, it's going to be left up to the individual business owner to decide how quick they want to open, if they want to open on May 1st. I think that's a really important message. Just because the governor said we can open does not mean you have to. If you're not ready, if you want to sit in the sidelines for a couple of weeks, we strongly recommend that, right? That's also something that's totally up to you. I think as you think about play spaces, if I think of restaurants that have full indoor enclosed play areas, we are hearing from a lot of our members that those are not being opened, especially in that first phase, which is from now until about May 18th. And it's really for as much about safety and sanitation as you have one more element you have to sanitize so frequently and monitor. And while you're trying to do that in your dining space, does it really make sense to have that open now? When it comes to places like a arcade or a entertainment eatery, I would look at two things: the movie guidelines that just came out, which talks about spacing between. And so if there's an opportunity for you to space out the gain areas. And then what we also see really well is people are marking the floor. So think about it as, I like to use this example. I know the team's probably sick of me, but it's like a twister board. And if there's someone on that red dot, you can't move there. And so there's a way to actually lay out the floor. In my mind, it kind of makes sense. And that way, you know that people will move in a flow where you don't have large groups. And I think one of the things you notice in the minimum standard health protocols is that on employees, it talks a lot about creating opportunities for them not to congregate, right? So, cashless transactions if possible, them having stations that maybe are separated so you don't have 5 or 6 over register at one time. And so I think we now sort of have this 25% we have to live with for a little bit. And now I think restaurant owners should kind of take a giant step back and say, I've got to have 6 feet per table between tables, not chairs, tables. And then I also can't have more than 6 at a table. And so what does that look like when I look at my patio and my entire floor and I've got my occupancy percentage, and sort of reimagine what that looks like in your restaurant now that you have that guidelines that, were published by the governor today.
I'll also add that he did in the executive order, Governor Abbott did say that venues such as bowling alleys and video arcades, that people should avoid those venues. Of course, I know we're talking about restaurants, but I think that's other guidance we need to keep in mind as we're thinking about these different spaces within a restaurant.
Yeah, so it may be that if you have a large eating area with gaming, that you open your eating area first at your capacity, get your crew back into it, and then open up that gaming space when available. And it's just really about lots of contact points and lots of people together. And that's what they're really trying to avoid.
Yeah, it makes sense. They want to keep people safe. The last thing restaurants really want to have happen is someone gets sick and the contact tracing come back that it originated at a restaurant, right? That's like the worst case scenario that we don't want to see. So that's really what it's about. It's not, governor wanting to kill anybody's fun. It's just trying to keep people safe, including children. We don't want the kids playing on their okay, so
one of the things that popped up in the chat box that's worth just pointing out while we're on this topic, just that everybody stays clear, is that the 25% capacity maximum and the 6-foot rule do have to coexist. So you each have to lay out your floor plans individually, and once you have that all laid out, you can look at it and say, okay, this is what my capacity is. It may be less than 25%, but you have to adhere to that 6-foot rule in between.
Mm-hmm. Good point.
Good point, Joe. Thank you for that. I know we have a lot of high volume restaurants that have joined us tonight. And so that's, that's definitely going to hurt some of them because they have a lot of tables in there. David Sia just asked if the 25% includes staff. And I believe it does. It goes back to the same count as before. Is that right? Or
right. It's 25%. You can have 25% of people in your building of the 25% of your occupancy. So it's not seating capacity, but occupancy.
Great. Good to make that designation.
Yeah, and I did see one I will bring up, because I know as you think about 25%, you can't maintain a business with that. But one of the things we asked for and other states have removed is we asked to keep the waivers for curbside alcohol and retail. And so I think it's really important as you ease back into your dining room that all of the same options that exist today will stay in place. So throughout the recovery, there's not an end date on those. And so as you're thinking about, for example, Mother's Day, maybe you do reservations that get you to the 25% of your dining room, and then you have special to-go kits for families that maybe don't want to take their mom out to dinner. And so thinking about how you balance those two is how I sort of start to get your head around it, because we will be able to keep those elements. Some states are opening dining rooms and then taking away curbside alcohol when they do, but we were able to maintain it. And I think we really appreciate that, because in some cases we have restaurants doing large farm boxes and retail boxes that are really helping to sustain revenue until we get these dining rooms back open at a higher rate.
Yeah. There's another question from Adam. Hey, Adam, asking if tables have to be removed or not just seated. Obviously, not everyone can move tables around. And yeah,
they do not.
No.
Yep, you don't have to remove them. I actually saw, I thought what a great example to help staff was that they had black and white tablecloths, and the white ones were where you could seat guests and the black ones stayed covered, and they had place settings on them. And so people could know it was, but then it also reminded any kind of staff when you have someone sitting people that those tables were never going to get sat. So you do not have to remove them. You just can't sit people within 6 feet apart of each other.
And that's actually a great alternative for people when you think about not everyone's got chairs that can stack as easy as it would be just take away those chairs from those tables. Some of you have banquettes that are built in. So somehow identifying a table that is not to be sat, it also helps if the health inspector pops by and wants to know, how are you measuring your 6 feet between tables?
There's another question too related to outdoor spaces that don't frequently have occupancy on the outdoor areas. I would say that maintaining the 6-foot distance is the most important thing there, but anything
Correct.
to add there with the outside seating?
No, I think that would be our recommendation. We've had a number of questions come in. We have surfaced that question back for clarification. But right now, if it does not have an occupancy number, we need to have 6 feet between tables. And that would be our best recommendation.
One of the questions too around here is about informing the consumer as they come into the restaurant as well. We were talking to a couple of health professionals this afternoon around this, and what we don't want to see is also an uptick of concerned citizens calling to report health violations on restaurants. So how are we going to communicate the new guidelines to customers as well?
Yeah, I think the best thing we can do, and I think that's really important, and we've seen some restaurants that have had drive-throughs open across the state, even across other states, and they've had what we call public shaming, or the Kravitz moment, right, where someone takes a picture of someone without a mask on and then shames them online. And I think there's two things. We feel really strong in the restaurant promise, and it's not a commitment that you won't get ill. There's no legal binding to it, but it's a commitment that when you enter inside, these will be the guidelines that you see being followed. Now that we have the governor's guidance, which is in this minimum standard health protocol, overnight we'll be updating that Texas restaurant promise with those guidelines to make sure that it's consistent, and we'll release that tomorrow. Again, it's not binding. As Governor Abbott said today, the guidelines are enforceable with the local authorities, is exactly what his words were. So if you decided not to follow those guidelines as a restaurant owner, there are ramifications of that. But I think on top of it, I think if we have every restaurant posting this on the outside of their door, which is, this is what will happen when you come inside, I think that's the best way that we can inform them at the moment, but also do a ton is what we're doing now, right, is getting out and the social channels, making sure we've just done, I don't know how many media interviews in the last hour and a half, but making sure people know what these guidelines are. And you have to be comfortable that if someone enters your restaurant and they're, are not following them, or they're not following the sanitary guidelines you outline, is asking them to leave. I think this is going to be where we're going to have to be in this together. And we're not going to be in a place where, we're going to allow some of these things to happen where we just become the public display of imperfection at any 1 second of any dining visit. So I think we have to be really ruthless about this and protect each other in each of our restaurants right now.
Completely agree. And I think that we also, too, if that happens in your restaurant and you have some people complaining because you've asked them to leave because they're not respecting social distancing, I mean, the Texas Restaurant Association absolutely has your back on your best judgment for that. So if it comes up, get in touch with one of us, and we're happy to help weigh in on that, especially if it reaches the media or anything like that. Kelsey, you were about to say something.
Yeah, I was going to say, I think one of the things that was really nice about the press conference where Governor Abbott outlined these guidelines is that really all of the leaders who spoke emphasized that this has to be a community effort. This has to be an effort of collaboration between businesses and their customers, that's the only way that this is going to succeed, which really is the message we started, as Emily said, weeks ago with the Texas Restaurant Promise. So we'll certainly continue to emphasize that, and also talk to our local government officials and public health departments to make sure they know that we are working collectively with them and want to be good partners. And I think most of our public health departments understand that and are working with us to, to emphasize compliance and getting it right versus a gotcha moment.
Yeah.
Yeah, and someone just asked about gloves, and gloves and masks are not required. The governor was clear about that in the order. Why face coverings, he does strongly encourage face coverings. The lieutenant governor suggested that we have face coverings. Again, they're not required. I just want to encourage everyone, though, that I truly believe that the guests will vote with their feet. And so if you're in a situation where all the restaurants around you have staff with their face covered and you choose not to, you might just want to look for those cues. If you want to go in that direction and it's important for you, then we encourage you to do that. So I think While it's very highly advised, it's not mandated to have gloves or a face mask unless they're already part of your sanitation procedures, for example, under Serve Safe. But any addition is not required, it's recommended. But again, I would really be thoughtful about guests are gonna come back and they're gonna choose to eat in a place and come back to a place they feel safe. So how do you create that? And I think we have heard, and I will pass this on to all of you, some of our task force members have been operating in a pretty high volume, especially some of our fast food operations. Some of them have indicated across the country that gloves have given a sense of comfort to guests. Now, I will tell you, someone walking out to your car with gloves on and giving you food is very different than when you're sitting at a table and someone is coming, and we know there's a lot of cross-contamination with that too. So not mandated, not at all. We've seen so many things flying around. Definitely not mandated, encouraged on face coverings. But I think you just need to think about and have lots of conversations with your guests. And I think they will help dictate what you do and don't do that's outside of the minimum guidelines that you have to follow.
Kind of got an odd question from Seth in the chat about how staff should deal with discarded PPE that guests leave on tables and in other spaces. First of all, ew, they shouldn't do that. Second of all, I would advise them to,
right, they will.
They absolutely will, but I guess they should pick it up with a gloved hand and dispose of it. Joe, you have
I was
something?
going to say either gloved hand, or you get a tape and tape off one set of tongs that everyone knows, black electric tape. That's the tongs for the bad stuff. You just literally go pick them up and toss them out. But yeah, definitely.
Yeah,
and then re-sanitize the table.
Yeah, I would recommend a glove. And then after every dining experience, that dining area needs to be sanitized well, cleaned and sanitized. And so if you do that, then you're okay. But I think if someone leaves something like that, like you said, like a mask or something, with a gloved hand right in the trash, and then as much hand washing as possible if you're not having gloves. And, obviously sanitation stations or opportunities for guests need to be throughout the restaurant.
And whenever we say sanitation stations, we don't mean it has to be one of those automatic dispensers, right? It could be a bottle of gel hand sanitizer. Okay,
yes.
Something.
Yeah.
Okay. That's enough for a station. Some people were asking earlier, they're like, that feels very official, like it needs to have like its own like area basically.
No, and you just can't argue with good hand washing. I mean, everything from the CDC is about good hand washing, a lot of hand washing. And when you can't do that, then you need to have the sanitizer or something. And we also know, and you noticed it wasn't in the governor's order. We're actually very concerned about a lot of the PPE or sanitizer, thermometers. I mean, a lot of these things, not only are they costly, but we also can't get them in all parts of the state. And we certainly don't want to be taking medical masks right now from our healthcare workers. So, we were pleased to see, because one of the things we feel strongly about as we go through this road to recovery is that we're going to have to get support from the state for some of these items. That's one of our asks, right, from the state or local authorities to help cover some of the costs that we're going to need. We all have to realize this isn't a month or 2 months. This is many months that we have, not the capacity, but just sort of how we're going to interact with guests until we get through this. And most importantly, there's a vaccine. So until then, we need to be thinking long-term, right? I keep trying to tell people it's hard, but it's long-term right now.
Yeah, it is. Joy is asking a question about, she wants to role play how to kick a guest out for not following the promise. Joy, Kelsey and I will work on some talking points that you can use to sort of initiate and follow through those conversations. And if you do want to role play with it, you can call Joe and he'll absolutely.
I thought Anna was going to volunteer to be the unruly guest.
No, well, Joe,
we can definitely give talking points. I think that's a good idea, because we are going to have people that are going to come in, and you just know it. We have people who now come in, we're not in a pandemic, and do things we don't want. So I do think as a team, we can work with some of our task force to and come up with clear guidelines about how we, because I know there's a health check for employees. So I think there's 9 elements, guys, that the employees, if they have any of those, it's very clear, and I think we'll post this tonight, but it's very clear in the minimum health standards for employees, but it's also in for the customers. And I think that's really important. So if our customers are displaying some of these things as well, we can encourage them. Definitely don't want to discriminate. I think it's really important, right? We don't want to start picking and choosing who comes into our restaurants. That gets us into a whole nother arena. But if someone comes and they're exhibiting some of these symptoms, it's definitely the talking points we can create for you, because you want to have that conversation.
Yeah, we can definitely do that. Kelsey, will you?
And I would also throw out on there, you know, don't forget about the curbside, the contactless delivery options for folks who,
Great point.
you know, really shouldn't be in the dining space, but you still want to be able to serve.
It's a great point. Yeah.
Kelsey, can you expand a little bit about, because we had a question earlier, I lost track of it, related to the questionnaire that employees are going to be asked whenever they come to work. What are those 9 points, and what does that look like? And yes, the answer, one I can definitely, we can single that part out.
I can pull them up too.
And the nice thing for folks who haven't had a chance to look at it yet, the governor's office literally made it a checklist. So they really tried to make it as user-friendly and straightforward as possible, which I think is very helpful, both for restaurants, but also our customers. So the things that they've highlighted, send home any employee who has any of the following new or worsening signs or symptoms. And then they elaborate: cough, shortness of breath or difficulty breathing, chills, repeated shaking with chills, muscle pain, headache, sore throat, loss of taste or smell, diarrhea, feeling feverish or a measured temperature greater than or equal to 100 degrees Fahrenheit, known close contact with a lab confirmed to have COVID-19. And then importantly, they spell out exactly how long employees need to not return based on, you know, did they get a test? What was the result? Those sorts of factors. So they've really taken the guesswork out of it and given us really clear guidance, which I think is helpful.
And we'll post all these tonight. We have all the individual ones as well as the Texans Helping Texans Handbook. So we'll make sure those are all in our newsletter tonight.
Yeah,
and I think what we've been saying from the beginning with the Texas Restaurant Promise is just to make it really simple and straightforward for your employees as well. So simple yes or no questions that stick to these guidelines, I think, are going to be best.
Mm-hmm.
Perfect. Let's switch it up because we've gotten a few questions on this around valet parking. So valet is not allowed, but what would you, what would we suggest to people on around valet parking, or what are some rules that we might be able to give them?
Park your own car. Just kidding. With no valet, right? We don't want that. Putting people in and out of people's cars, I think right now is making sure that you just suggest to people where they can park and create opportunities as they pull up to give them opportunities to park. But other than that, I just don't think there's much advice we can give restaurants, right? It's going to be tough. But that's if you can work with your the parking lot, maybe where you had valet spaces, to block those off for your guests, to send them in that direction. But I think it's just one more contact point and one more exchange where we just don't want to have that right now.
And there is an exception for vehicles with disabled parking placards or license plates. So make sure that we're taking notice of that.
Good point.
Yeah, good. Yeah, there are probably some empty business parking lots close by that you can use too. Probably those salons are not going to have anybody parking there for a while. So, okay, let's go over here. This is an interesting one from Jerry down in RGV. Has the governor given any indication on how long the alcohol to go mandate will stay, or exemption will stay in place?
Yeah, no, he hasn't given a date. I think it was, the good news is it's been extended. We know our recovery will be long. We are definitely, I think we've heard some indications that they are pleased in the governor's office at how this has gone. We've done a good job. The restaurants have done a really good job. And so we will absolutely want to extend this for as long as possible. And I think Kelsey and I have already had some discussions about having this as one of our legislative items that we would have to go through next spring. So I think if everyone continues to follow the rules, we've shown that it's a great success. We know that it's one of the #1 things that helped restaurants through this, that we're able to still operate. And so we've built, I think, a pretty strong business case for us to be able to continue with this. But for the foreseeable future, we don't see it going away. And retail, I can tell you in a specific call with the governor's office, retail has really helped them ensure that Texans have access to food. And so I think in some of our really hard hit areas, what we don't realize is restaurants serving other essentials outside of just their food has actually helped give people access to food and maybe some of the food insecure areas. And so that's another really good testament to what restaurants have done stepping up in the last couple of weeks.
Let's talk a little bit about self-serve, specifically around buffets and fountain drink stations. I know all four of us were talking about this just before the webinar started. Kelsey, do you want to take this one?
Sure. So the governor's requirements does specify that if a buffet is offered, and I'm reading the exact language just to be clear, if a buffet is offered, restaurant employees must serve the food to customers. So the good news is you can continue to have buffets, they just need to be driven, or for lack of a better word, the employees need to be doing the serving versus a self-serve situation. That is as specific as it gets. So in terms of self-serve drink stations and that sort of thing, they're not specifically addressed in the guidelines. I will say the sanitation piece becomes important too, because of course any surface or area that's commonly touched needs to be frequently cleaned and disinfected. So those are kind of the guidelines that we have. And I think it goes back to what Emily said about making sure that we're building customer trust and following their guidance.
Great.
Yeah, I think the more you can self-serve right now, I mean, you serve, the staff serves, the better we're going to be. So I think thinking about how you're going to lay out, we've had a number of restaurants call us to say, okay, here's what it looks like. I have lemons and I have straws and I have the fixings for barbecue here. And, you know, our recommendation was just put those right behind where you plate the food already, and then just simply ask, would you like a roll? Would you like salt or pepper? Would you like, and do it behind. And so I think it's just, we've got a couple of days, right, to get kind of some of the stuff organized. But when in doubt, just go the safe route. I just made up a rhyme. That's pretty cool.
That was good.
There's the tagline for it right there.
It's good advice, really, across the board.
Yeah, and even on the self-serve stations, you can put a staff member there who's handling it for people. I mean, again, it comes back to sanitation, and you want to have someone standing there cleaning it after every time someone uses it, or just have someone there who's doing it and then regularly cleaning it.
Yeah. Okay, we've had a couple questions related to the jurisdiction of the governor versus the mayor and the counties, and I know there's a lot of questions around that. Emily, can you try and tackle who is in charge of what area?
Yeah, and first I'll say that I did put a note into the governor's office that we're going to talk after this, just so I can get an update on the employees and staff, 25%. So I know David Sia, I saw you question that, so I will get an answer. I just don't have it on me, so I will get that clarity, and then we'll post it on the Facebook page tonight. I think there's two things in the executive order, and again, I'm going to go back to consistency. It's really hard for us to manage businesses that are outside of one city or county if all the rules are different. And so there's sort of two critical pieces that Kelsey pulled out. And then the first one, which is in the executive order, no jurisdiction can impose civil or criminal penalty for failure to wear a face mask. This is important for our friends in Houston in particular, because their face covering or face mask order went into effect today, I believe. The second is, this is also important right out of the language, conflicting local orders that attempt to restrict essential businesses that have been reopened, which includes dining rooms, are superseded. And what he means by that is that if there is something happening local, there's this order supersedes that. And so we would like to continue to be really clear that what the governor outlined today with the minimum standards of health protocols for restaurants is what should be adopted across the state. And that's really, really important. So we've already have, and our inboxes are full of folks that have different things happening around their cities and counties, and you want to keep referring to them to these protocols that were issued by the governor, and we want to stand behind them, and we'll stand behind you, because this should be the law that everyone is following. We do know, same as when we had our first closures, that we will have parts of Texas that are going to be more challenging, and they challenge this executive order. Please come to us directly, and we'll help you walk through this. Does that capture it, Kelsey?
I think that's absolutely right. And I would just emphasize again, as you're hearing, hopefully our local officials will, take this guidance and say, this is great, thank you. But in the off chance that you do get pushback, please let us know so that we can help with that communication.
Yeah, we're happy to engage. We've had so many discussions with judges and health departments and you name it. And we've got chapters, 20 chapters all across the state. So if you are hearing things, we know some places we are. Before this, we actually, as this came out, it's not been as crazy, but once you hear tomorrow, we get up and you hear anything, just please come to us directly, one of us, and we will help you with the messaging. And we're more than happy to get on the phone with your local officials too, and just walk through and maybe even give them the kind of the science and the health and the well-being and sort of the operations that went into these guidelines, so they have comfort that these are the right things to do.
Absolutely. And one other thing I want to plug too is that TRA has a county tracker that we're using to track what's going on in all the different 254 counties across Texas. And so that'll help you keep track as well. And it's in alphabetical order. I'll make sure that that gets sent out to everyone once this is over, and you can take a look at that. Obviously, it's going to change come Friday, but we've got the details in there already about who's allowed to open at 25% versus 50% capacity.
Should we talk about that real quick? I'm thinking we should probably mention the 50%. And I saw some confusion already on the Facebook. Oh, sorry, Anna, go ahead.
Oh, no, you go for it.
Okay. No, I just realized the 50%. I'm seeing some people on Facebook talk about we can't open because we have more than 5 cases. That's actually not it. It's that all restaurants are able to open May 1st with 25% of their occupancy. But if you have 5 or fewer, so let's say 6 or more don't qualify, 5 or fewer, you can actually go to 50% if you work with your local jurisdiction. So don't think if you're X restaurant in a small town that you can just throw your doors open at 50%. Kelsey maybe will have, I think she's dug into this. The first measurement is that 5 or less, 5 or fewer. And then the second is that you have to get a validation of the numbers. We also have that tracker now. So it shows, I think there's 260 counties. I think I've said 254. So are we sure?
Kelsey and I are Texans.
Yeah, the 2 Texas girls.
That's right. I'm sorry. I'm from Connecticut. I don't know. We have like 1 county in the whole state of Connecticut. But no, yes. So someone just asked, we have the tracker. We also have, which is going to track what's going on, but we also have now, we got the list, which is we were putting it at the end of every email every night. It shows you every single county and how many cases. And so you can just spot check, just go down to where it starts with 6 and then look everything below it, 5 and below. And you'll see which counties you could get to 50% on May 1st, but you've got to go to your local authority because your local jurisdiction is going to have to validate that number and then tell you if you can get to 50%. The one thing that's so important, guys, is if all of a sudden there's this massive flare up and we have a very high number of cases or a very high number of fatalities, we can imagine numbers getting reduced again, percentages. So I think that's really important as we kind of have this gift right now as some hope. But if all of a sudden things start to change, we would be smart, right, to not cause a lot more pain. So I think that's that 5 and below, just make sure you check that website and we can post it for you. And it's a live tracker for the state, and we also have one for the US. And so the one for the state will tell you every day what the numbers are, and it's a great thing to follow.
Mm-hmm.
And that's David, again, just to reiterate, it's 5 per county, not per business. 5 per county, and just go to that tracker and it's got them listed. More than half the counties in Texas fall into that category.
Yeah, and keep in mind the county judge is the one who has to do these certifications and that sort of thing. So they're who we all need to be working with as we move through this process.
Those of y'all that are receiving Emily's email every night, it's the map down at the bottom of the email. If you click on that, that's where you can go and see that tracker as well. We use it to sort of update you every night on what the numbers are looking like, but that's where you can find it. But we'll send it out again tonight as well. I got kind of an interesting question in the chat from Jake on vendors. Are vendors subject to the wellness checks upon entering restaurants?
That's a good question.
Yeah.
I don't know if I saw that actually listed.
I don't see it
listed. No.
No. Although, at the very beginning, there are guidelines just for all people and for all businesses. And those same symptoms appear throughout.
Yes. Yep. And so there's just sort of like all people, all Texans. And it does talk about if you don't feel well or you have any of these different symptoms that you should not enter a building, you should stay home. And so I think that's probably the same route right now versus singling out our vendors. I think, if there's a health screening, you may want to ask your vendors, hey, these same 5 questions. Your vendors are your partners, and so I can't imagine them pushing back. Many of our vendors, and really we call them partners, are doing their own screening, right? So they're doing some things before they even leave the building to make sure that people are safe, their employees are safe. And so that will likely continue, but I haven't seen a carve out for our partners. But, you know, I would think that's just a good two-way communication with you and the person you're working with to kind of rebuild, right? I think that would be my advice.
And part of it is just using your common sense. I mean, if you think about it, if somebody's just delivering something to you versus it's one of your vendors who's coming in to service your soda lines or your taps, like, use common sense. It goes back to the sanitation point. If it's someone who's going to enter your building and be there for an hour versus dropping off a few cases at the back door.
Yeah, we have to add that Joe's family was in the restaurant business for 50 years. So that's probably why he gets like common sense. But yes, that would be, if someone's going to be interacting and immersing in your ecosystem, is probably different than someone who's dropping off your morning run. And so I think, again, this is all about communication and building trust. And so I don't think anyone right now is going to hopefully cause too much trouble when we just want to make sure people are healthy and safe.
Yeah, absolutely. And then someone in the chat also mentioned that some of the drivers are having their temps checked before delivery. And imagine, Tiffany, you work for probably a broadliner or something like that. So that's good to know. In fact, great. We'll follow up with our vendors just to see what their policies are. I'm sure that if they have one in place, they would want us to know about it. So that's good. There's been a few questions to this, and I think now is a good time to, since we're about 20 minutes left, around employees that have been laid off or furloughed, and when they're asked to come back, some of them are refusing. Now, before Emily answers, I will remind you that we are doing a webinar on Thursday at 10 a.m. with the Texas Workforce Commission, Commissioner Demerson and Tommy Simmons, who everyone here loves. They're going to be answering all of our questions, so definitely tune in at 10 a.m. on Thursday. But Emily, what are your thoughts on bringing employees back if they refuse?
Yeah, I think I'm going to also let Kelsey come on the back end of this one, but this is a big topic. And I think we know a couple things. I'm going to dive into the PPP just for a second, because we can't lose sight that that's also still going on. So the new money came in today, the second round of, I think, $310 billion. We've heard lots about the site being really down, lots of inconsistencies, frustration, and that's from the bank side, trying to actually get the applications into SBA, because of course, when it went live this morning, all the banks that have these sort of stacked up that are doing so much great work trying to get these things into SBA. So today was a little bit clunky, but we expect the money to go quite fast, okay? So as you think about the kind of that world of PPP, one of the really key points of that is, in order to get your loan forgiven or turned into a grant for that 8-week period, you've got to have similar payroll to prior to the pandemic. Well, we first started finding out, really, we knew the $600 a week, which is the extra allotment of unemployment that today runs through July 30th, that was incentive, and frankly, for some people to actually be home. Now, it's a balancing act, because we want our employees to be taken care of while we can't have them back in our restaurants, right? At the same time, what's been pretty clearly articulated and why we've asked the Workforce Commission to do this webinar for us is to hear right from the horse's mouth. There is a couple of our agencies have been amazing partners, and I put the Workforce Commission at the top. I mean, they have been exceptional. And if there's an employee that you furloughed or laid off that is currently home, and you offer them a job to come back with a very similar salary, they're required to come back. And so, and if they don't, they have the risk of losing their benefits. And so that would be number one. That's the harsh reality. And I think you've seen some of that, where restaurants are calling and having employees say, nope, I'm going to stay home until at least the end of July. Well, if you've given them an offer of employment to come back because you're going to reopen, and they deny that offer of employment, then you can actually, they can lose their unemployment benefits. But I feel like that really gets to be not fun, right? Do you really want to force someone to come back, right? I mean, I get in more on maybe the personal, what it's like when that employee's back. Well, there's also something called work share, and there's a work share program in Texas that allows you to actually bring an employee back for X number of hours a week and to stay on unemployment for X number of hours a week. And so Tommy's going to walk through that as well. So if you're not ready to have somebody back full time, you may be able to do a best of both worlds, help the employee and help your restaurant. So we're going to walk into those details, but I think the bottom line is we're hearing a lot more of this as people are starting to recall their employees. I also encourage you to have a discussion, if you can, with that employee. Having a job with the economy that we're going to face here for probably the next year or two is a lot better off than riding it out till July 30th and then hoping to find something in August or September. Those jobs may not be there. And I think that's what we have to help people understand. And I think the more that we can continue to have all the elements of revenue open, get these dining rooms, be healthy about it, follow the guidelines, get that occupancy moving, the more they'll be able to make as we start to service more customers. But try to also get them thinking about the long game. And what you don't want to do is turn down a job in hand that you probably loved before in hopes that after July 30th, you'll just be able to find one, because I think that's going to be a lot harder than people think.
And actually, Emily brought up the PPP as well. So in addition to the TWC webinar that we have on Thursday, tomorrow at 2 o'clock, we have a webinar, I've Got My PPP, What's Next? We'll have several panelists there, including an accountant and a banker to answer your questions and walk through all those pieces. So we'll share that link for you as well.
Yep, and then the shared work program, I think someone just noted, yes, that it's incredibly frustrating trying to get through to the Texas Workforce Commission. They've got lots of other agencies actually jumping in just to man phone lines, and it's not even their agency. And so I encourage you to please come to the webinar, and if for some reason you can't at that point, raise your question to Tommy Simmons directly. But if you're stuck in a queue and you're really trying to drive the shared work program, please send Anna and myself a note. Hopefully there won't be thousands of you, but let us try to help, because I know Anna's like, what did you just do? But I know if you're trying to get your business open and you're just waiting. And so if we can be helpful at all, that's what we're here for. We can't wear out our welcome mat, but I do know when I've had emergencies that Tommy or the commissioner has been extraordinary getting back to us. So if that's your case, just send us a quick email. But that shared work program, you can get it approved. And I know they've been promoting that because it's a really good way to give employees and employers the best of both worlds.
Great. Okay, one other question related to, this has come up a couple times, and I know we've already covered it a little bit, but it looks like some people have come in late. Kelsey, real quick, can you just touch on self-service stations again and buffets?
Yes, so buffets, if offered, restaurant employees must serve the food to customers. And I think I saw something about salad bars. I would say a salad bar is a buffet. So that needs to be served by your employees, not self-served by the customers themselves. And any kind of frequently touched or used surface or area needs to be cleaned and disinfected regularly.
Thank you. And Jessica, I'll circle back around on your question towards the end too, if we have time. But we did answer a lot of questions related to patio. If you're looking for it, look in the chat or look in the answered area under Q&A. So just look there for that. Patrick has a good question though about silverware. It's clear that silverware cannot be present on a table, but for counter service operations, can it be delivered on a tray with the meal? Does it need to be individually packaged or wrapped? What are the suggestions there?
Yeah, I didn't see any, and Kelsey's always really good about, she's been digging into this like crazy. I didn't see any specifics. We know you should not have any utensils out where people are able to go into one container to pull something out. It'd be much better to have someone who has gone through the safety protocol, sanitation protocol, either roll them up where the person who's handing them out isn't touching that utensil again, or having them prepackaged. We know a lot of restaurants that is sort of to go, or when you can get away with it, into pre-packs with a napkin, and just handing those out is an option with someone with gloves on.
Yeah, the only thing, I think that's exactly right. As long as it's not, sitting out on an unoccupied table, I think you're complying with the guidance here.
Yep. And if you're sitting customers and you're cleaning each dining area as they're leaving, and you're not sitting anyone again, I think it's okay to have the single, not the single use, but maybe salt and pepper that you can clean, right? The challenge with a lot of restaurants is that you have customers who may sit at a dirty table waiting for you to come clean it off. And so we've had people say, well, I'm going to go to single serve, but it's actually going to take me a while to get that. And so I think you've got to we never ever want anything left on a table with any guest who comes that has not already been fully cleaned and sanitized. I think that's really important. So think about that as you think about how, and I think for all of you, even those that have a drive-through that have been doing 80% of their business, that inside dining room experience will change. And so I think it's really being thoughtful about, how do I have my customer come in, have a great experience, knowing that I'm going to have to change everything. And then if you change 50%, you're better off. But I think just knowing that it should feel different is going to help you make the right decisions.
Great. Okay. Okay. Yeah. Thank you, Adam. Okay. Next question. Again, we have another question related to self-serve drink station. Just pour it for the guests. It's better that way. Just like Kelsey and Emily have said multiple times. And then there have been a couple questions related to live music. Tom asked this question earlier: can we begin to reschedule our live music bands with 6 or fewer members, all other guidelines in play? Good question, Tom.
Yeah, go ahead, Kelsey. I'll tell you what I recommend, because it's not,
Yeah, I don't see anything that prohibits that. I think social distancing is key, as we've alluded to. The party size is key. Sanitizing, I think that would be considered an area that needs to be sanitized or disinfected before and after.
Yeah, and if you can have 25% of your capacity and still have a live band at 6 or less, I think then kudos to you, because I know, but some people have one person, right? One instrument, and that should be no problem at all. What they don't want to do right now is have anything that would create an event-like atmosphere where you would draw lots of people that would stand in a crowd. I think it's one of the reasons you saw them not open bars today. We actually have some really good ideas about how to do that successfully, because we want to see our bars open. But again, it's the idea of lots of people coming to one space, and that's what they're trying to avoid. So I also know that our musicians are hurting, right? I mean, really hurting. So if you're able to bring one back and sustain that with a 25% dining room capacity, then please do it. But I think that's going to be the limiting factor. It's just the affordability.
Right. Since we mentioned
what is
bars,
a bar? David Sia, what is a bar?
Thanks, David.
As we're on the topic of bars, I do want to make sure and mention too that reopening dining spaces is the way they defined restaurants excludes those who have 51% of their gross receipts from alcohol and have to have that TABC sign. Mm-hmm. So I know, we're talking to some of our partners who do have more of that model. And so just make sure you're mindful of that if you fall in that category.
And that actually should answer David's question. Yep.
And we'll, of course, continue to work on that. We understand our bars and restaurants that rely on alcohol service are hurting too. So.
One other idea on the live music thing that I just wanted to throw out there, because we've seen a few restaurants do this with their curbside operations, is they've had live music or DJs play in the parking lot where people can still enjoy the music, but they're just sort of coming through and leaving. And then it still gives you a chance to hire the musicians and have them there, but there's no congregating because you're just moving people through the line, right? So that's just some idea that we saw that looks pretty good. I have some pictures of it from Houston specifically.
As long as people are apart. I mean, it's really the key, guys, is that if all of a sudden, we have local authorities or lots of video of people posting online, large groups standing around someone in a parking lot listening to music, we're just going to set ourselves back. So I think Anna's right. Being creative about it, trying to set up an atmosphere to give someone some work is a great idea. And you know what, I've even seen outside, people are marking the ground. So as you're waiting, I think I saw someone, reservations are a great way to make sure you don't exceed your capacity. And so if you have reservations in place where you can keep that limit, but then also outside mark where people can stand. I know it sounds juvenile, but people will follow that. They will go and they'll stand and wait, or they can certainly wait in their car. That's an option too before it gets to be 100 degrees. So I think there's lots of ways to keep people, but if you can go like this and touch the person next to you, you're too close, right? So it's back to like kindergarten. And I think that's anything you read, social distancing's here for months and months. And so this is something we're gonna just have to get used to.
Sherry is asking about the part at the very beginning of the order that says the hand sanitizing station available whenever you first walk in. And she says she's having a hard time getting sanitizer. We actually have a lot of vendors that we're working with that are able to get it, including a lot of our liquor partners, our distiller partners who switched over to manufacturing hand sanitizer. If you really can't get it, please email one of us. I know that we can find it for you. It may not be from your usual supplier, but we do know a lot of people that are manufacturing it right now.
And Anna also did a really good job on face coverings. And so for some of you that's the route you may want to go, again, it's not mandated. On the COVID-19 website on our txrestaurant.org, so the Restaurant Association's website, there's a special COVID page. She actually has a lot of the PPE that has been sourced, because that's also an issue. People can't find it, or it's so unaffordable if they do. And what we don't want is people just trying random stuff if you want them to go that route. So Anna, I think that's another place to send people to.
Exactly. And we have vetted each one of those suppliers too. So they're good companies. And one of them even is made in Dallas. because I know some people were concerned about items being manufactured overseas. Totally understandable. We did find one that is manufactured in Texas, of all places too, which is great. The question, Leo has a question in the Q&A window related to, can you legally open for carryout curbside delivery if you have a 51% sign and you have a kitchen with a permanent location to operate as a restaurant? And I know we've been dealing with this actually for a while since TABC put out one of their directives. Emily, do you want to touch a little bit on what you can or cannot do?
You know what, I'm going to actually punt and I'm going to ask TABC. And I say that because there's this plus this could equal this, and I don't want to give the wrong advice. And so now that the new executive order has come out, we can just text TABC tonight and just say, okay, here's the situation. And then we'll just post it on the Facebook thread. It's a really good question. I think I know the answer, but again, I don't want to give you the wrong advice. So let me just run that scenario by them and I'll come back and we'll post it.
Okay. And I do know if you want to start looking at, the TABC has a website. It's they do their best, but it can be
great guys.
Really do. But it's on their coronavirus guidance page too. So if you want to start looking at that page on tabc.gov, you can take a look there. .tx.gov.
And Anna, should we touch liability real quick? I've seen it come up a couple times.
We should talk about it.
Yeah, this is one that probably makes me the most nervous, not for any reason other than whenever you get the word liability, right? It kind of is a little bit scary, probably not for Kelsey, but for someone like me. But I think there's two things. This has come up already, and you know, what we believe, and then I'm going to have Kelsey jump in probably with a more legal opinion, but is that if we're following the guidelines that are set by the governor, and these guidelines are happening in our restaurants, and we're doing the protocols that have been outlined, that if someone does get ill, the liability would be limited because we followed from the national protocol down to the governor's protocol into our restaurants. So we are talking actually between workers' comp, with the different insurance companies trying to come out with how do we make sure our restaurants are protected, especially once we do testing and contact tracing. So can someone come back and say, I specifically got it in that seat in your restaurant, and what does that mean to the restaurant? And so Kelsey, if you want to jump in at that point, because I know this is something that has made people consider not opening right away, but obviously this is going to be with us for a long time. And so that option to never reopen for most is not an option.
Yeah, what Emily said is exactly right. You know, it's critical that we follow the guidance that Abbott has laid out today, that the CDC lays out, to protect our employees and customers, but also to protect ourselves and our businesses. You know, ensuring that's really step number one. I would say step number two is we continue to talk to businesses in various sectors that are facing this similar concern and talk about how we can best sort of codify the correct standard and make sure that there's comfort there. So those conversations are ongoing. I think they will only ramp up now that we're starting to reopen. And I know that Governor Abbott and our policymakers understand that concern. We've certainly made it clear to them that that is at the forefront of restaurateurs' minds as they begin to reopen. And so those conversations will be ongoing, and we'll certainly push out any guidance that we can as we get it.
Yeah, and that's a reminder, right? It's not just us. What's that?
Oh, wow.
Oh, crazy. It's not just us, right? There's so many businesses opening. You could go to your job in an office building next week and have something, you know, and pick this up. So I think that's number one, but also I think it's, you know, we're going to get some better, not even assurance, but as Kelsey said, really understanding, because our understanding today is if you follow the guidance, which is the law, and that there is protection on liability, but we want to make sure to give you that comfort. So I think there are a number of organizations and associations that are engaged in this now, and it's a huge topic. And so we will, I think, very quickly come back with making sure that you all feel safe. Now, if you aren't doing the things you're supposed to do, if you're not social distancing, if you're not sanitizing, if all those things can be evidenced, well, then obviously you are liable if someone gets ill. It's no different than if you were doing food safety and sanitation and didn't have any certified food handlers, for example, in the state. I think it's the same thing. We just have to follow the law, but we'll definitely give you comfort because it's something that's coming up a lot, but it's us, it's retail, it's everyone is having this discussion.
Okay, we are down to the last 60 seconds of the planned session. I know we answered a lot of questions. Guys, you're asking a lot of questions that we've already answered before. And in the interest of saving Emily and Kelsey's voice, I don't really want to go over them again, but you can certainly see the recording later You know, we're always around to answer other questions. Kelsey, we might even want to just put an FAQ together so that people can go just straight there, similar to what we did with mixed beverage license confusion earlier. That might be helpful. But any final thoughts, Joe, then Kelsey, then Emily?
I think, you know, where we're at, guys, is just be smart. Think about how you would kind of do things normally and just amp it up a bit. This is obviously an opportunity for restaurants to lead, but our bar cousins are waiting to join us. And if everything goes well over the next couple of weeks, that'll happen. We're working really, really closely with the Texas Bar and Nightclub Alliance. They're adopting our promise as a bar promise as well to push out. So, you know, if we do this right and we show that we're being responsible, then when they've collected enough data by the 18th, then we get to go to larger capacity. They get to start to open and life starts to go back to whatever normal looks like when this is over.
Yeah, that's exactly right. I think my advice is just to keep the long game in mind. The phrase I keep using that I think I stole from Emily is sustained recovery. That's what we want. It doesn't do anyone any good to have a week of reopening and then we close everything down again and make it even tougher to reopen. So just really thinking about the long game and, you know, please know that we're working on reopening at the same time we're working on PPP fixes, at the same time we're working on, you know, disaster loans and tax incentives here. I think I saw someone ask about that. We're working to try to get better tax relief. So we know this is just one part of the bigger puzzle to helping restaurants recover, and that's what we're focused on.
Yeah, and so I'll just close with, first I want to thank the team because you know, these are long days and nights, and it's really just to make sure we help all of you. And so whatever we didn't know tonight, and I'm so proud of how much we did as quick as this has come out, but you know, we will post it. I think most importantly, I think is that we've gone through 6 weeks of this and we can't lose sight of that. And so now that we're kind of at this finish line of getting to go to this next phase, I just really ask everyone to have some grace and some empathy and for each other. For the process. I have to say I get the fortune of being part of a national group of state restaurant association CEOs, and we meet once a week. And I can tell you that this has been so well organized and so thought out for the, you know, the 7th largest economy in the world, essentially. I'm really impressed at how the governor has tackled this and frankly, how he has kept us engaged. We even got a heads up before all this rolled out. And so I think we just really want to be thoughtful about that we have a governor who's using data, is using science. If we had our guests, I mean, all of us would have the weddings and birthdays and celebrations and everything we would want, but that's not what's been doled out to us. All we can do now is follow the guidelines that I think are really going to safely help us keep this restaurant sector open. And so as you get anxious, please think of that. Please try to refrain from any second guessing right now from if I was governor, I would do this, or if I was Emily, I would do that. I think you've got to understand there's so many moving parts that I think Kelsey so well put. This is one piece. We've got to get the PPP fixes, which I'm so tired of saying. If you ask my daughters, where I say them more than anything, it's PPP, which is crazy. But we've got to get that fixed. It's just crazy that we can't get these loans converted, or people get this money and they don't know what to do about it. So we've got to get the tax incentives in place. We've got to get funding to help us with all the things that we're going to have to do for the next year. You know, we need rent relief. There's so many things that are currently on the radar, but what we got today was we have a date. We have a date that on May 1, we can begin to get our restaurants open. That I'm going to celebrate tonight. And frankly, it was a relief because if you asked me this morning, if we got 75% ability to open on every corner of the state, I would have panicked because I do not want this to happen again. So let's do it slowly and correctly. And whatever you need, Anna just gave you our email address. I think most of you know we do our best to get back to you within sometimes hours. And we will continue to do that. So send your questions and be supportive. Let's keep the hate down. Let's keep the positivity up, and we will get through this. And we're Texas, right? I know I wasn't born here, but I've adopted it quickly.
I'm so glad that you did. So glad you did. All right,
yeah, Connecticut's going to open like September, so I'm really glad I'm here.
We have to. We're Texans. We have to eat outdoors. We need our patio dining during the summer. So that's good. We're ready.
Patio dining.
Mm-hmm. Well, thank you everyone so much for joining us again. If you need anything, please email. Everyone stay safe out there, okay?
Thank you guys. Take care.
Thank you.